Have you ever walked into a room and suddenly realized there's a strange smell coming from your own body? It could be unusual breath, stronger body odor, or an unpleasant smell that you never noticed before. We often think that body odor is simply caused by food, sweat, or daily habits. But what very few people know is that our bodies can talk to us through scent. According to the National Cancer Institute, certain types of cancer can produce volatile organic compounds, causing the body to emit unusual smells that we can detect. And if you know how to listen to these signs early, you can protect your health or even save a loved one's life. So today, I want to explore with you 5 types of cancer that may give early warnings through body odor. Stay tuned until the end, because there are some very important signs that many people overlook. And don't forget to like and subscribe to support the channel. The human body has a complex metabolic system, and when cancer cells develop, they produce volatile organic compounds that are released through breath, sweat, urine, and feces. These compounds create distinct smells that could be warning signs. According to Dr. George Preety, a chemist at the Monell Chemical Senses Center, unusual body odors can be an important sign of some cancers because cancer cells alter the body's metabolic processes, leading to the release of volatile compounds that we can detect through smell. Imagine this. One day, you notice that your breath has a sour smell, like spoiled yogurt, even though you've brushed your teeth thoroughly. Or when you use the bathroom, you notice that your stool has an unusually strong, foul odor, different from before. This could be an early sign of colon cancer. The intestines contain many bacteria that help digest food and maintain a healthy microbiome. If a tumor develops and slows digestion, food will ferment longer, leading to stool with a stronger, persistent foul odor. Additionally, colon cancer disrupts the digestive system, and gut bacteria can produce volatile gases, some of which are absorbed into the bloodstream and expelled through the lungs, causing the breath to smell like fermented food, overripe fruit, or spoiled yogurt. Moreover, bleeding from tumors or polyps in the colon can release iron-rich compounds, which when broken down, create a rancid smell. Blood can mix with stool in 2 ways. If bleeding occurs from the small intestine, the stool may be black with a burn smell. If bleeding occurs from the large intestine or rectum, the stool may contain bright red blood and a distinct foul odor. Additionally, the breakdown of protein in an oxygen-deprived environment can produce sulfur compounds, causing gas from the intestines to smell like rotten eggs or decaying flesh. But it's not just the digestive system, even the liver, the most important detoxifying organ in the body, can send warning signals. Surprised? Let me explain. The liver is responsible for detoxifying the body, but when it is affected by cancer, toxins accumulate in the blood, causing the breath or sweat to smell like spoiled fruit or ammonia due to the body's inability to process urea and nitrogen compounds effectively. According to Dr. Mark P. Matson, a liver cancer researcher at the U.S. National Institutes of Health, when the liver is damaged, its ability to detoxify is reduced, leading to the accumulation of ammonia and nitrogen compounds, which in turn creates a noticeable foul odor in the breath and sweat. Some patients report that their body odor smells like old cooking oil or fishy. By now, you might think that simply controlling your diet to protect your liver is enough, right? But there's another organ you can't prevent from being exposed to harmful environments, the lungs. And lung cancer can also release warning odors. So what does that smell like? Don't worry. The answer is coming up next. Let's take a look. Lung cancer affects the respiratory system, where air is exchanged and oxygen is processed. When the lungs are damaged by tumors, they can release volatile compounds that cause unpleasant odors. Some patients report their breath smells like rotten meat, decaying flesh, or rotten eggs. The bad breath can originate from the lungs, not the mouth, So unlike bad breath caused by poor oral hygiene, this odor comes from the lungs. No matter how well you brush your teeth, the smell won't go away. If you notice persistent bad breath lasting more than 2 weeks, especially if accompanied by a chronic cough, possibly with blood, difficulty breathing, unexplained weight loss, or chest pain, see a doctor immediately. According to the American Cancer Society, early detection of lung cancer can increase survival rates by over 50% if treated promptly. So, don't ignore small changes in your breath or body. And one more thing I want to mention is that cancer doesn't just occur in internal organs, it can also happen in your bloodstream. That's leukemia. Some patients describe their breath as smelling like chemicals. The cause is the metabolic disorder of white blood cells, increased uric acid in the blood, or a weakened immune system that alters the microbiome in the mouth and intestines. In leukemia patients, a weakened immune system allows bacteria on the skin to proliferate, causing the sweat to have a stronger odor than usual. Additionally, systemic inflammation can increase body odor, making patients feel as though their body smells unpleasant, even after showering. And finally, which type of cancer could this be? If your breath has a particularly unpleasant odor that won't go away, be especially cautious about oral cancer. You might think, can cancer even occur in my mouth? Yes. According to research from the University of California, patients with oral cancer may release polyamines and sulfur-containing compounds, creating a very unpleasant odor. Some patients report smells similar to rotten meat, decaying animal flesh, or long-decayed odors. This happens because a tumor in the mouth can damage the gum tissue, tongue, or mucous membranes. Even after brushing, using mouthwash, or antibacterial rinses, the smell still doesn't go away. According to Dr. Camille Farah, an oral cancer expert, many patients go to a dentist for persistent bad breath without realizing it's an early sign of oral cancer. Health is the most valuable asset we have. Our bodies are very intelligent. They always try to send signals when something is wrong. But do we really listen? Don't wait until it's too late to act. Early detection can save you or your loved one's life. If you notice any of the signs mentioned, don't wait, go see a doctor immediately. If you found the information in this video helpful, share it with your family and friends. It could help someone detect a disease earlier and have a better chance of treatment. Hit subscribe and turn on notifications to not miss out on important health information and disease prevention. Wishing you and your family health and peace.